I'm going to announce who will be speaking. So first we have Zakirah Abdul-Hameed from Morehouse School of Medicine.
Good afternoon, everyone. My name is Zakirah Abdul-Hameed. I am a Master's of Public Health student at Morehouse School of Medicine. This summer, I worked with my mentor, Dr. Desiree Rivers, and we focused on understanding the role of a plant-based diet to improve outcomes in postmenopausal African-American breast cancer survivors. So according to the American Cancer Society's 2023 Cancer Facts and Figures, 43,170 breast cancer deaths will occur in 2023. They predict that 40% of these deaths will be Black women. Breast cancer is the leading cause of cancer deaths in Black women. Black women are 17% less likely to be diagnosed with breast cancer, but they are 42% more likely to die from breast cancer than white women. 1 in 5 Black women are diagnosed with triple-negative breast cancer. When looking at the rate of breast cancer deaths by race and ethnicity, we see a 6 to 8 survival gap with Black and white women for each and every single breast cancer subtype. If you look at the graph, you will see that Black women are more likely to die from breast cancer in comparison to any other racial group. Once women reach the age of 50, their postmenopausal years, we see that the rate of breast cancer deaths increase significantly. But the good news is that a plant-based diet can contribute to improving postmenopausal breast cancer survivorship. When comparing the dietary patterns, we see a plant-based diet is very anti-inflammatory, high in polyunsaturated fats, and very high in fiber. We know that fiber is a very important nutrient that helps the body to absorb nutrients and boost the immune system. In contrast, when looking at the westernized diet, it is very inflammatory, high in saturated fats, and provide little to no fiber. So if you are at risk for breast cancer or you are looking to improve your survivorship outcomes, it seems very ideal to adopt a plant-based diet. But due to the racial and the socioeconomic injustices that are still affecting us today, we see diet-related disparities. Black households are 3 times more likely to face food insecurity, and these numbers are steadily increasing since the COVID pandemic. Black communities have excessive access to dollar stores and liquor stores, which are highly processed and nutrient-poor foods and overprocessed foods. Due to the history of redlining, we're seeing a decrease in full-service grocery stores in the Black community. Black people are found 43% less likely than white people to meet the USDA fruit and vegetable guidelines. 21.3% of Black people consume fruits and vegetables more than 5 times per day, but a majority of the Black people at 78.7% consume fruits and vegetables less than 5 times per day. So my objective of my research was to explore perceptions and knowledge of a plant-based diet and its role in breast cancer survivorship. For my first method, I conducted a literature review. I used the PubMed database, looking at articles from 2010 to the present, using the keywords breast cancer, plant-based diet, high risk, postmenopausal, survivorship, and African American. So I began with 4,248 articles, but I did an exclusion criteria, removing any duplicates, removing anything that did not compare the plant-based diet, and removing anything that was published before 2010. This left me with 15 articles. I chose 5 articles to be representative findings of the 15. 3 articles showed that Black women were less likely to adopt a plant-based diet due to the lack of affordability. 2 articles show that Black women are more likely to adopt a plant-based diet when it reflects their cultural cuisines. So additional findings show that postmenopausal women who practice plant-based diets pre and post-diagnosis have significantly lower odds of breast cancer than those who never practice a plant-based diet. We also find that plant bioactives provided cancer protective nutrients. My next method was a focus group. I used medical patient data from Grady Hospital of 2,413 postmenopausal African-American breast cancer patients. I created this flyer and recruited 60 patients for a focus group. I presented the flyer at clinics and contacted the patient list. Looking at the results from the focus group, the women that I spoke to shared their stories, and they helped me to understand that Black women that were diagnosed with breast cancer were more open to plant-based diet changes post-diagnosis. They needed time to let this diagnosis settle in because it changed the whole trajectory of their life. But once they received the diagnosis after spending some time further understanding what they just got diagnosed with, they were willing to adopt this plant-based diet. We also found out that Black women were more willing to stick to a plant-based diet once they seen the improvements in the outcomes post-dietary changes. Black women were more likely to adopt a plant-based diet when they knew the benefits. How would this help them? How would this help them to decrease the risk of breast cancer, not only for themselves, but for their families? How will this help them to improve their survivorship outcomes? They were more open to adopt a plant-based diet when they seen that it was financially feasible, that it would not make a major dent inside of their budget. They were also more open to these diet changes when seeing that it was culturally adaptable, when seeing that they could see themselves represented in a plant-based diet. So major themes that I've seen from the focus group was first, cost barriers. Black women stated that they felt that a plant-based diet was too expensive. They noticed that fresh fruits and vegetables have very high spoilage rates, causing them to have to grocery shop more frequently. The next theme that I seen was the support system. This was very important to many of these women. They stated that hands-on support from their medical team made all of the difference in helping them to stick to the plan that would improve their survivorship outcomes. They stated that the support and participation from their family also helped them to maintain this plant-based diet. The next theme that came up was cultural competence. Black women stated that they felt that it was very hard to find plant-based meals that adhered to the African-American cuisine. They did not see representation of the cuisines that they grew up with traditionally whenever they looked up a plant-based diet. They did not want to have to completely change what foods it is that they eat, but instead finding ways that they can adjust the ingredients to still have the foods that they love while having a plant-based diet. We also spoke about plant-based nutritional literacy. Black women stated that they preferred to receive plant-based dietary information from medical professionals who were culturally relatable. To highlight some quotes from the focus group, participants spoke a lot about cultural competence, coordinating services, and social support. We've seen a lot of Black women who stated that they found their own culturally relatable holistic sources. They spoke a lot. Specifically, we got quotes about the Dr. Joe and the Hallelujah diet. When looking at the coordinated services, Black women stated that they really appreciate the fact that their doctors were working directly with nutritionists, and this helped them to have a very clear plan for survivorship. Having support from not only their family, but from also the medical team made a huge difference in their survivorship plan. So in conclusion, here's what we found. Black women prefer to receive nutritional literacy education from individuals and health professionals who are culturally relatable. We also found that Black women want to find more ways to explore and adopt a plant-based diet to eventually improve survivorship outcomes. We've seen that Black women are more likely to adopt a plant-based diet when it is cost-effective and satisfies their taste for their cultural cuisines. And we also seen that Black women are more likely to adopt and maintain a plant-based diet with support from their family and their medical team. So we're seeing that Black women, they want to adopt this diet, but it is very important for them to see themselves culturally represented in the plant-based diet sector. They also want to learn and explore more ways on how they can improve their survivorship outcomes. So I would like to acknowledge the American Cancer Society grant and give a great thank you to the SCRIPT program, my mentor, Dr. Desiree Rivers, and my school, Morehouse School of Medicine. Thank you so much, and I'm now open to questions. So she asked, how did I find the women's participation in the focus group? So the great thing is that these women were excited to participate. They wanted to help because they seen how important this is for Black women. They wanted to make sure that more Black women weren't going through the same problems that they went through and trying to see if they can help in any way. So I did find that a lot of these women, they wanted to help, they wanted to provide this information to us, and they stated that they would like to continue to take part inside of our study as well in the future. So I did have a very positive outcome with the focus groups. Yes. That's a really good question. So the question was, what are my next steps since finishing this part of my research? So I definitely would like to continue to speak to more of these women, and I would like to see in what ways we can change the dietary guidelines, because it is not enough to tell Black women that they must change their diet, but we must tailor these diets so that they can see themselves represented inside of this plant-based diet. So that is definitely something that I hope to do in my next steps. Yes. Thank you so much. So this is a really good question. I feel like a lot of people get plant-based confused with vegan and vegetarian. So plant-based just focuses on having more whole foods inside of the diet, having more things that are very fresh. Whereas a vegan diet, there is no meat and no dairy. Plant-based just minimizes that. So it's 90% of a whole food diet. Yes. So the question was, what type of fruits and vegetables were the women consuming that still adhere to their cultural cuisine, but as well as the plant-based diet? So based on what we heard back from the focus group, collard greens is a very common cuisine that we have in the Black cultural diets. So these women, they did not want to stop eating the foods that they grew up on, but instead probably taking out some of the ingredients such as the ham hock or the high salt content, so that they can still have the foods that they love while adhering to the plant-based diet. Yes. Thank you. I'm sorry, I didn't hear the question. So mostly the questions that we focused on were for the focus group. The literature review just provided the information that was needed. So not questionnaires from me. Yes. So that's not something that I have done yet, but that is something that I would love to do. So as I continue to work with my mentor, if that is something that she is willing to work with me on, I would love to be a part of it. Thank you. Yes. Thank you. This topic? Yeah. Mhm. No, I truly don't think it would make a major difference. Because of the fact that I believe that just having the plants incorporated into the diet, especially the whole foods, it will provide nutrients, but I do not think it depends on which form it is. So I believe your question was stating like, does it matter which form the fruits and vegetables come in, whether it's frozen or fresh? So that's not something we had further gotten into inside of the focus group, but that is something that I would like to explore as well. Okay, yes. Thank you so much.